Hello, everyone. This is case study 2 for the COVID-19 pandemic. This is for Group 9, role as the president. Now, just an overlook on the case study. On December 31st, 2019, China reported a cluster of cases of pneumonia in people associated with the Wunan seafood wholesale market in Wuhan, Hubei province. On January 7th, 2020, Chinese health authorities confirmed that this cluster was associated with the novel coronavirus 2019 nCoV. Although cases were originally reported to be associated with exposure to the seafood market in Wuhan, current epidemiological data indicate that person-to-person transmission of 2019 nCoV is occurring. As of January 30th, 2020, a total of 9,976 cases had been reported in at least 21 countries, including the first confirmed case of 2019 COVID infection in the United States, reported on January 20th, 2020. As of April 24th, over 2.7 million cases have been confirmed with over 194,000 deaths across 185 countries. As of June 5th, over 6.75 million cases have been confirmed with over 393,000 deaths across 210 countries. Now, as the president of the chosen country of the United States, I will now go into the response, control, and role of the president within the COVID-19 pandemic. Now, as a response, initially would be to conduct an outbreak investigation. Now, an outbreak investigation includes 4 main steps known as confirm, describe, determine, and control. Firstly, we need to confirm the disease burden and confirm an outbreak using outbreak criteria. Secondly, we would need to describe the source of the infection, modes of transmission. 3, determine who is the case, how are all the cases found, and describe these cases within time, person, and place. Now, lastly, would be to control. However, control can be initiated any one of the previous 3 steps, and that would be initiating behavioral interventions, such as mask wearing and social distancing, vaccination, medication, infection control, such as PPE, health education, especially for the masses, and active surveillance. Once an outbreak has been confirmed, I would alert the public. I would then engage an emergency response protocol for infectious disease outbreak. By doing so, I would need to utilize the public health systems, such as the Centers for Disease Control and Prevention and the Department of Health and Human Services, in order to provide me accurate incidence rates, methods of transmission, surveillance data, epidemiological data, and those most at risk and vulnerable populations. Now, as part of my response, I would educate the public, and this would mean to provide accurate health education on how to prevent contraction and transmission of the virus. I would also need to provide resources, and this goes as federally funded systems that are be given to states, but also working with states and those states most in need. So, and those provided resources would be affordable rapid testing, personal protective equipment, necessary medical supplies and equipment such as ventilators and medication, vaccinations, and financial aid and funding for small businesses, as well as the rest of the people in need. Now, I would also need to identify high risk and vulnerable populations, hotspots of transmission, such as major port cities and cities involved with a lot of international travel. Next, I would go into a control phase. This would be done by doing, firstly, executive orders, such as mandatory mask wearing in public places, social distancing of at least 6 feet, quarantining for 14 days for those tested positive for COVID-19. Providing these executive orders would set a precedent and example for the states as to how to effectively control and prevent future transmissions of the COVID-19 pandemic. Now, contact tracing, I would also be utilizing. Contact tracing is an effective disease control strategy that involves identifying cases and their contacts and then working with them to interrupt disease transmission. This includes asking cases to isolate and contacts to quarantine at home voluntarily. Now, limiting travel, especially to high incidence areas. Also, importantly, is active surveillance throughout all phases. This is to monitor the spread and the intensity of COVID-19 disease within the United States. It is important to maintain this active surveillance to first understand disease severity and the spectrum of illness. Secondly, to understand risk factors for severe disease and transmission. And lastly, to monitor for changes in the virus that caused COVID-19, as well as to evaluate whether our intervention measures are being successful. Lastly, I would develop a COVID-19 pandemic response plan to protect and further support the people of the nation. Now, the United States government and the White House has put out a 7-point plan to beat COVID-19 and coincides with a lot of the orders and structure that I would also utilize as president. And that would be 1, ensure all Americans have access to regular, reliable, and free testing. This will enable us to really get a hold of accurate data and measure disease burden in those places most vulnerable. I would fix personal protective equipment problems such as lack of and inability to obtain PPE. I would provide clear, consistent, evidence-based guidance for how communities should navigate through the pandemic and the resources for schools, small businesses, and families to make it through these hard times. I would plan for effective, equitable distribution of treatments and vaccines, because development isn't enough if they aren't effectively distributed. And we have seen that as a result in the United States. Despite having vaccines, we did not have a full plan on how to distribute and how to effectively distribute such vaccines, which could have led to a delay in those who need the vaccines to get it first. I would also make sure to protect older Americans and others at high risk. Rebuild and expand defenses in order to predict, prevent, and mitigate pandemic threats, including those coming from China. Creating and updating an emergency response preparedness plan. Although we have emergency response preparedness plans in place, COVID-19 still seemed to elucidate the weaknesses in our emergency response preparedness. In order to reinforce and become more well-equipped for the future pandemic, we would need to start from now in recreating a more appropriate emergency response preparedness plan. And one of the most important things, I would implement mask mandates nationwide by working with governors and mayors and by asking the American people to do what they do best and step up in a time of crisis. I have provided this graph to show the essential functions that would be utilized in order to tackle COVID-19. Now, these essential functions would be used in the acute phase of a pandemic. Number one, surveillance and detection. Making sure we have laboratory capacity, making sure we're conducting outbreak investigations, continuing the monitoring of the epidemic, and assessing the risk and severity. Clinical management, making sure we have proper patient management, health service continuity, making sure we have infection prevention and control in healthcare settings, such as PPE. Also making sure we are prevention of the spread in the community, initiating medical countermeasures such as vaccination and prophylaxis, as well as using non-medical countermeasures to contain and mitigate the infection, such as behavioral modifications. And lastly, maintaining these essential services, around the country and making sure we have enough funds and workforce to recover. Thank you very much.